Hello, doctor. Can you hear me? Doctor? Hello, doctor. Hello, doctor. Can you hear me? Doctor? Doctor? Hello, doctor.
Yes, Lucy, I can hear you.
Doctor, can you hear me? So now,
Yes.
please go to the your PowerPoint and show it and start the presentation.
Okay.
Okay.
Can you hear me?
Yeah, I can hear you.
And can you see my screen now?
Yeah, I can see your screen now. So please just show your slides and start the presentation. Okay, no problem.
Okay.
Yeah, everything
Should,
everything's
should
good.
we start?
Yeah, please start now.
Okay. Good evening, good morning, good night, wherever you are. Myself, Dr. Ankit Arora. I'm an oral and maxillofacial surgeon from 𝐴𝐵𝑠, New Delhi. It's a premier institute in India, and I'm here trained for 7 years regarding the various maxillofacial oral surgeries. And here I'll be taking class or the lecture on Introduction to Piezo Surgery, where we will be discussing regarding the usage of piezotome. Okay. It's basically dedicated to my OMFS team, right? Where I have been trained here. This is the lecture presentation and the team where I have been taken proper training. Okay. Regarding the conflicts of interest, I have nothing to declare. I have used various type of piezotome in my career journey, be it Action, be it woodpecker, and I have used many. And in this presentation, we will be discussing about the usage of piezotome, basically the woodpecker one and the Surgitouch, and we'll be discussing about the various uses. And in the present lecture, we'll be discussing about what are the basic introduction to piezotome, where it can be used, what are the benefits and advantages to it, and accordingly we can discuss. The course schedule is, it is basically the course is divided into four types. The introduction to Piezo surgery, that is being today, that is the 20th of March. In the next week Sunday, we'll be discussing about the usage of Piezo surgery in implant, be it insertion of implant, be it bone leveling, be it rich split. We'll be discussing about various condition where implants can be put with the help of piezoelectric unit. And in the third lecture, we'll be discussing regarding the sinus lifts. There are various alternatives to sinus lifts, be it direct or indirect, and the other techniques and the different techniques of sinus lift, the lateral one, the hexagonal one, the square one. These are the different types of sinus lifts which we'll be discussing on 3rd of April. And the last one is the different application of piezotome in various conditions and various situations like oral and maxillofacial surgery, like the other various conditions where we can use in orthodontic surgery, in iliac crest harvesting, in Lefort surgery, in genioplasties. There are various application of piezotome which we will be discussing on 10th of April, and there are many different use cases, and we'll be discussing them in the coming subsequent lectures. Now, the objectives are of present lecture that will include why piezo surgery, when we have different rotary instrument and that are available in the market and that can solve our purpose, why we need to go for piezo surgery. Is it really necessary, or should we keep continuing with the usage of rotary instruments? Now, what are the components of piezo surgery? Is it heavy? Is it costly? And how to use piezo surgery, which we will be discussing in the coming slides, right? Now, interaction of piezotome. Why the piezotome and how it interacts with the coming surrounding bone, soft tissue? Is it harmful to the tissues? Is it really interactive, or is it really releases the bone morphogenic protein or other inducer protein that will either harm the structure, or it will, I would say, rather benefit the structure, which we'll be seeing it. And lastly, understanding the fundamentals of the piezotome, right? Now, this is the objectives of present lecture. Now, considering that on the first step, why is piezo surgery being made? It is developed in response to the need for greater precision and safety in bone surgery than was available with other manual and motorized instrument. That is, when we have available rotary system and other motorized instrument, then in such cases we need to shift to better alternative. That is, that will allow more precision, that will allow better healing, that will allow less inflammation, and in all to all will provide us better patient compliance in comparison to other rotary instrument. To that lead to the invention and the usage of piezo surgery. And in the year 2005, the US Food and Drug Administration, they extended the usage of ultrasonic in dentistry to include bone surgeries, right? To include the bone surgeries. So we can use piezo surgery from now on, and from that, it has, I would say, led to a various advancement and to an astonishing effect that it can lead to surgeries in various anatomical location which would not have been possible without the invention of piezotome. So coming to the effect of why and what is piezoelectric effect. So in one sentence, I would say is instrument that is used for ultrasonic cutting of bone by creation of micro vibration. You can see in the diagram there, the tip is moving in a to and fro motion, and that motion is ultrasonic motion. And when these instrument that is used for cutting of bone, then in such scenario that is known as piezoelectric effect, right? Now, what is piezoelectric effect, which we are discussing? You can see in this red arrow, that is, when these micro vibrations were created by the piezoelectric, where certain ceramics and crystal they are deformed, and when electric current is passed, that result in the oscillation of ultrasonic frequency. That results in the oscillation of ultrasonic frequency. So in such scenario, the piezotome and the piezoelectric effect, it plays its role. So let us see what happens when an electric current passes from this generator to the piezoceramic rings or the resonator. This resonator of piezoceramic rings, these vibrations they obtained are amplified and transferred to a vibration tip, and these are transferred to a vibration tip. That these tips are known as inserts. Okay, these tips are known as inserts. Okay, so in such scenario, what happened in such inserts, they are basically helpful in directly attaching the piezotome to the bone. How come? When these waves they are transmitted to the handpiece tips, they are basically known as inserts, right? And they leads to longitudinal movement resulting in cutting of the osseous structure, right? They results in the cutting of the osseous tissue by microscopic shattering of the bone. Okay, what happen is, they when they get applied, they keep continuing, and they keep on doing the start. Okay. Now coming to the frequency. Okay, a frequency of 25 to 29 kilohertz is used because the micro movements that are created at this frequency, piezoelectric cut only the mineralized tissues. Okay, only the mineralized tissue. Okay, so in such scenario, what happened is, whenever you use the piezotome, whenever you use it, the piezotome, it do not cut the soft tissue. I will repeat, it do not cut the soft tissue, it cut only the bone, because it works at that particular frequency. That is the wonder of piezotome, my friends. Unlike other rotary instruments, it do not cut the soft tissue, whereas the with other instrument you have to be very precise that you are not entering into the soft tissue zone, into the periodontium, into the attached gingiva, into the tongue, into the cheek, into the lips. So there you have to be very very careful and forget about the anatomical structure. If you are very much used to using piezotome in such anatomical location, it is very very useful. Let us see in the coming slides how it is useful. Okay. So when we see and review the literature, and that is a very excellent article which was published in British Journal, and it was written by Eggers et al. And he said that whenever a soft tissue interaction is seen at a frequency, that frequency need to be greater than 50 kilohertz. Okay. And in the previous slides we have already seen that piezotome works on the frequency of 25 to 29 kilohertz. So as a result of which, what happens, there is no soft tissue laceration, and at the same point of time you can see how exactly and how refined the cut and the precision of the piezotome is there. You can see with the help of that piezotome, it is not including, and it is not including the burr. You can see the block which is being harvested of from a particular site, right? You can see the dimension of a microburr, which is very less in comparison to the piezotome. And when we have the laser, the ergonomium YAG laser or other size comparison, which we feel that the piezotome, the block which you have harvested, obviously because of the size of the inserts is the tip that is being used in piezotome. And when we see this piezotome, it is basically very much larger, very much bigger in comparison to the other mode of cutting the bone, right? See, the effects of mechanical instrument on the structure of bone and viability of cell is important in regenerative surgery, right? See, when we see the effect, right, the effects of mechanical instrument on the structure of bone and viability of cell, it is very much important in regenerative surgery, be it periodontium surgery, be it implant surgery, be it sinus surgery, be it any maxillofacial surgery. The viability of the osteoblast cell, that is extremely important, which are in conjugate and in proximity to the inserts or the tips of the piezotome. How? Let's see. Basically, what happens in rotary cutting instrument is there's a macro rotation and macro vibration principle. Okay, that is involved in the rotary cutting instrument. What is macro rotation and macro principle? It is basically that it generates sufficient heat, okay, and it creates sufficient heat, and it do severe damage to the bone, which results in the marginal osteonecrosis. Okay, so in such scenario, in such scenario, what happen is it result into the severe damage of the bone, that is known as marginal osteonecrosis. In that, what happen is what happen is there's a marginal osteonecrosis. Okay, and that result into the severe damage to the bone. What happened in such cases, the damage which result into the severe damage to the bone, that is known as marginal osteonecrosis, which is very much important. Let us discuss that concept, marginal osteonecrosis. That Erickson et al. Showed that local bone necrosis would occur in cases where the temperature exceed 47 degree for 1 minute due to the contact of rotating tools. Okay, this is of particular importance in success of long dental implants. Okay, so what happen in cases of long dental implant, where the length of the implant is more than 11.5 mm, be it 13, 14, 15, or more than that, say 18 mm implants. So in such scenario, at the apical end, it become very very important to get the flush of the water to reach at the apex of the bone, which is very much important for the success of the implant, so that in and around the osteonecrosis do not happen. That is, when it doesn't happen, what happened is the osteoblast, they kept on due to heat more than 47 degrees Celsius, they kept on dying. Okay, and when that happened, the necrosis pressure, and that result is that result into the failure of the structure that you have put, be it the surgical procedure, be it the implant. So that basic concept of marginal osteonecrosis, it holds very I would say very much importance in the success of long dental implants. Okay, very much long dental implant. Okay. Okay, just give me 5 minutes so that I can rejoin, because I'm getting notice that my camera is not on. Okay, just give me 2 minutes. Okay. Hear me now?
Hello, doctor. Just click the start camera. Yeah. Please go back to the StreamYard, doctor.
Okay. You can you okay. Now you can hear me. Okay, so let us complete this seminar. So other drawbacks are irregular rough osteotomy and increased bleeding and increased vibration of the handpiece, and there is a limitation of the dexterity of the surgeon, right? Okay, so in such scenario, what we need to do is we have to understand what are the drawbacks that are being referred by the other rotary instrument. So now coming to the different component of the piezo surgical unit, which are present and which are there, and we have to understand them. See, there is an insert tip which you have already seen. There's an handpiece which is present universally in all the other rotary instrument also. There's a pump, peristaltic pump, which diffuses the normal saline or the other saline solution, and it consists of hand, piece, and foot switch, obviously, so that by your foot switch you can connect to the main power unit, right? So in such scenario, this has a holder for the handpiece and contains irrigation fluids that create an adjustable z of from 0 to 60 ml per minute through a peristaltic pump. Okay, this has a holder for the handpiece and it contains the irrigation fluids. Now let us come to the why do we need piezosurgical unit. There's a very nice article that was published in the International Journal of Periodontics, right? That was covered by Vercelotti and De Pauli as, and they have beautifully covered that why on a first hand we need piezosurgical unit. The first would be that it has a very great precision and safety in bone surgery. Whenever you deal with bone surgery, you need to be very precise, very articulate in handling the soft tissue, the bone, and the associated structure. Okay, so it need to be very much manipulate in nature. We have to save 1 mm or 2 mm of the bone in and around it. So, and second would be it remove the debris from the cutting area and it ensure the precise cutting, which is there in cases of only piezotome. What happens in other rotary instrument, if we consider, be it aerotor or be it straight hand piece or be it other saw region, it what it does is when it start moving, it do not remove the debris, and the collection of the hand pieces, it keeps on collecting, and in as a result it infect the surgical site. So in such scenario, piezo surgical holds a great importance in removing the debris from the cutting area and ensure the precise cutting, right? Ensures the precise cutting. So, and the third, it maintains a blood-free operating area. Okay, it maintains a blood-free operating area, which will be seeing how and how the usage of piezotome maintains a blood-free operating area. Obviously, it holds a very different scenario that whenever you operate in a surgery, blood is paramount. It is as necessary as breathing in normal life. So, but in contrast, when you use piezosurgical unit, you have a very nice blood-free operating area, right? Now, the fourth part is when we use it, it provides greater visibility, particularly in complex anatomical locations. So, in such scenario, the piezotome holds a very much importance because in complex anatomical locations like the posterior mandible, like the posterior maxilla. So in such scenario, you need to have a very greater visibility because of the anatomical location. You cannot see the lower mandible in the sagittal half of the area. Okay, or say when you are cutting, when you are putting implant in the sinus lift region, so you need to see the area. Oh, so because of the LED light that is attached to the handpiece, it allows the greater visibility, and at the same point of time, you can manage single of bone in such areas where single of bone is more important than the dust of gold. So in such scenario, you need to be very much particulate, and considerate in using the piezotome. Now you can see a very beautiful diagram where you can use the piezotome in bone surgery like sinus lifts and all. There the greater precision, the single amount of bone, and the precision, and the safety area, it is basically useful, right? So in such scenario, the greater precision is very important. What happened is the allowing the high, precise, and safe cutting of hard tissue, despite and while sparing the adjacent soft tissue, which we have already read, because piezotome do not cut, the soft tissue, and it by its own nature, it makes it superior to the conventional rotary instruments, right? So it basically makes it superior. Coming to the literature part, what happened is, coming to the literature part, that the bone morphogenic protein, that is BMP, and other growth factor like transforming growth factor and tumor necrosis factor and interleukin, they were evaluated in osseous samples when compared to the conventional rotary instruments like air rotor and other handpieces, and the piezotome usage. The analysis, it clearly shows that the neosteogenesis, that is the formation of the new bone in and around the implant and other surgeries, it was found consistently more active in bony sample that has been prepared using piezoelectric surgery. This particular thing, which we'll be seeing in the coming lectures of sinus lift surgery also, where we have seen that the densification as well as the vitalate structure is available, and is seen that neosteogenesis is seen on the usage of piezoelectric unit, right? And we have already seen, when there is a bone morphogenic protein and transforming growth factor is there, there are fewer pro-inflammatory cytokine in and around the implant. There were fewer pro-inflammatory cytokine which was seen in bone around the implants. Okay, so in such scenario, we have seen that there is an early decrease, right? Now let us come to the piezoelectric bone surgery. It seems to be more efficient in the first phases of bone healing. So what happened is, the when you prepare the bony socket, be it implant, be it extraction, be it sinus lift, be it BSSO, if you prepare the first phase using the piezotome, what it does is it induces an earlier increase in bone morphogenic protein. It induces an earlier increase in bone morphogenic protein, and these bone morphogenic protein, it controls the inflammatory process. That is, it allows the bone to remodel, it allow the inflammatory cytokine to reduce, it allow the bone morphogenic protein to increase in concentration at that particular site, and hence it stimulate the remodeling of bone as early as 56 days after treatment, which was in comparison from 90 to 120 days. That is exactly half in comparison to other conventional methods of cutting the bone, that is the rotary system. And this study was conducted by Pretty, and in the Journal of Periodontology, it was published in the year 2007, and they have seen that it involves the fixation helps. It also helps in the osseointegration of the implants by allowing the concentration of the growth factors in and around the bone exactly surrounding the implant. So now you can see the different. Okay, so in case you can see the difference between the exact cutting of the bone, as well as there's no debris in the cutting area, and it allow the precise cutting, which you can see. Can we appreciate the splitting of the bone, and the splitting of the bone in this area is only about 1 to 1.5 mm, which we have splitted it beautifully. So in such scenario, you can remove the debris from the cutting area and it ensures the precise cutting. How is it possible? Basically, what happen is, whenever you use the rotating conventional tool, it minimizes the undesirable seeding of cortical bone chips into the surrounding area. What basically happen is, when you cut the bone with the conventional rotating instrument, it also cut the cortical bone which is less than zero point 0.5 to 0.75 mm in thickness. So what happen is, it undesirably cut and seed the cortical bone chips into the surrounding area, which is in itself very important in implant in various factors, be it osseointegration, be it subsiding below the cortical level, or be it the compact pressure of the periodontium in a longer duration of time. So in such cases, there is a phenomenon known as cavitation, that cavitational energy that flushes out all the microparticle and it cut the debris all along. So in such cases, what happen is, there's a phenomena of cavitation. What is that cavitation? We'll be discussing it in the coming slides. Okay, in the coming slides, right? The there are another studies that was done by Lens CA, and that was done in the year 2008. They've seen that in the complex surgery, as complex as orthodontic surgery, piezotome has a upper hand in comparison to rotary conventional instrument, because they show the viable, that is the living osteocytes, that has the normal morphology and differentiation at the marginal osteotomy side. That marginal osteotomy is the site where the usage of piezotome has taken place, and that single usage of piezotome in complex surgery like orthodontic, be it Lefort, be it genioplasty, be it BSSO, or be it any variant of orthodontic surgery, they have found that the blood loss was very minimal in comparison to the conventional instruments. The time that was required was very less, and the nerve and the vessel integrity, which is very very important in complex surgery like this, is very what you call, it is preserved using the piezoelectric, and the osteotomy that was done by the piezoelectric was very refined. So let us come to the another advantage of piezotome, that is, it maintains a blood-free operating area. You can see it here, the osteotomy site. It is being done here, and it is being done under local anesthesia. It is not done even done under general anesthesia, where we have done a xenoplasty and the piezotome, the pencil-shaped piezotome, we have done it, and it is of very you can see the very clean site, because it maintains a blood free operating area. Now we will be going into detail why and how the piezotome maintains a blood free operating area. That is because of the cavitation effect of the ultrasonic vibration. So in such scenario, the osteotomy site, because of the cavitation effect, it shows very less bleeding. What is that cavitation? Cavitation is nothing but a spray of liquid that goes from the handpiece to the operating surgical site. So but the only difference between this spraying of the water to the conventional rotor piece or aerotor or handpiece is that whenever cavitation occur, the vibrating tip that is being there, it goes into the bone with the vibrating tool, and it happens when the water spray contact and inserts, it start vibrating to the intermediate frequency. So in such scenario, the cavitation produces a relatively bloodless area. Okay, so the process of vaporization happens, which we were seeing in the previous slide only. Then the bubble generate, and subsequent implosion of the water with the tip, and that result into the growth and collapse of the bubbles simultaneously. So there are many events that are happening simultaneously at one point of time at one site. So what happened is, in the coming side, there would be minute fraction of its original size. That is, the gas bubble will form, will collapse, will grow, will collapse, and at the same point of time, the tip will keep cutting the bone. And as a result of which, there is no place for vessel to bleed or bone to bleed. As a result of which, you will find relatively bloodless or blood relatively clean area in comparison to the conventional side. Let us see this in real pictures and in the coming slides, where the bloodless area or cavitation plays a very important role. So the linear vibration, they're practically imperceptible to the surgeon. I have not seen a single difference that these things are happening, that they are vibrating in both the longitudes, that is the horizontal and the vertical longitude, and it is not affecting my dexterity when I am working in an anatomical delicate area as close as to the inferior alveolar nerve in case of orthodontic surgery in mandible, or as close as to the sinus lift, be it the Schneiderian membrane, or I am working in the tuberosity region. So in such scenario, the linear vibration or the piezoelectric scalpel, they are practically imperceptible to the surgeon, and it do not affect the dexterity when I am working in an anatomical delicate area. Now you can see that these are the relatively cross-section area. This is the lazy S incision, which would not have been possible by any instrument that is available in the market other than the piezotome. You can see both the mesial margin and the distal bone, mesial and buccal and the lingual halves. And if I can cut it as per my requirement, I can obviously go as per the visibility. So it allow the greater visibility in the zone of maximum anatomical limitation. Okay, so let us see it again. This is the orthognathic surgery which we have done, and when bone is being cut, the micro cuts which we have already discussed. Okay, which we have already discussed, that these micro cuts, they allow the bone to be burnished off and left smooth with uniform cut ends. Now you can see it here. We have cut the maxilla into two halves, the upper half and the lower half. Despite the maxilla, it is supplied by various bunches of arteries, be it ascending palatine, be it greater palatine, be it nasopalatine in the frontal area. There's no blood zone which is being seen here, which is of paramount importance when you perform complex surgeries like this, which can I would say the time period which can extend from 2 hours to 6 hours. There the 1 ml of blood holds a very important measurement. Forget about the larger values. So in such scenario, the cavitation process as well as the other bone what you call burnishing, which is being done by the piezotome, it allows the uniform cut ends. Okay, so obviously in the coming lectures, what we will be seeing is how the usage of piezotome, how the usage of piezotome is helpful in preserving the lower border of the mandible or the maxilla fracture, where the lesion has encroached as close as to the lower border of the mandible. So lower border or the inferior border or the proximal location. So in such scenario, you can see the usage of piezotome holds a very important role. Okay. Okay, at the same point of time, you can see the osteotomy. The osteotomy is further facilitated by the presence of gradation mark on the piezoelectric scalpel, that is also known as inserts, which gives an estimate of the working depth. Okay, which gives an estimate of the working depth, right? So in such scenario, it gives a gradation mark that, okay, I need to go till 6 mm, I need to go till 8 mm. My CT scan analysis shows that nerve is around 10 mm, so I will be going with the scalpel only 8 mm. So these gradation marks helps along that we need to be very much particulate, and at the same point of time, we should know where our anatomical limitation is, where the inferior alveolar or other limitation is. If we need to put 6 mm implant in cases of sinuses, we need to stop precisely at 5 mm, that is 1 mm below the sinus membrane, so that we can lift the sinuses and we can put our implant. So in such cases, these piezoelectric scalpel gradations, inserts gradation, are very important and help us, guide us, and as well as prevent us to do blunders in the surgical site. So the viability of the cut ends and minimal trauma, they results in early formation of the cortical bone at the osteotomy sites, which leads to rapid and uneventful healing. So what we do is, we do not we do not go for the unevent, I would say, the eventful healing, or we do not want inflammation area. We do not want more of the inflammatory presence, be it inflammatory cytokines. And the minimal trauma, if at all it happens, it leads to uneventful healing, which is there at a very rapid pace. And the less inflammation also causes less pain and swelling, and it increases the patient compliance. Okay, obviously, when there is a less pain, there is less swelling, there is gradual or and improved mouth opening, there is a gradual less inflammation, so it increases the patient compliance altogether. Okay, so is it all good for piezotome, or is there anything which is not there in piezotome? So I would say there are obviously some drawbacks to it, and let us discuss them accordingly. The Before that, we will see the application of piezo surgery. What is that piezo surgery? It is helpful in dentoalveolar procedures, and you can use it when you are going to cut the tooth. There's one question from the audience named Sohrab Singh. He has asked, can we cut the tooth? Yes, you can. You can separate the tooth roots with it. You can hemisection it. You can root amputate it. Okay, and periodontal surgery. It is helpful in periodontal surgery. There are various inserts that are available that helps us in doing the periodontal surgery. It helps us in doing the apical resection, commonly known as the episectomy. Okay, and the endodontic treatment. Endodontic treatment can also be done with the help of that piezo surgery. In dental implantology, you can prepare the implant socket so as to densify it, and alveolar ridge splitting, which we have seen it, and we will be coming and seeing in the coming lectures, recontouring of the alveolar crest and the mental nerve repositioning. These are the dental implantology sections which we will be seeing in the help of the piezotome, and accordingly we can see the uses of piezotome. Okay, we can see the piezotome, right? And okay, application of piezo surgery in maxillary sinus bone grafting surgery. We'll be seeing this in the third presentation of our lecture, that is the preparation of bone window with lateral approach, atraumatic dissection of the sinus mucosa. We'll be seeing this. We have beautiful 7-8 cases done and performed with property documentation, which we can see this, and I have performed in numerous cases using the piezotome. And there are internal sinus floor elevation, directly or known as indirect sinus lift. And in maxillofacial bone surgery, we can use it. In maxillofacial bone surgery, basically you can use it for orthognathic surgery, which you have already documented, be it iliac crest graft surgery, be it in bicoronal graft surgery, or if you want to put a orbital graft, or you want to put a genoplasty or anterior maxillary osteotomy, you can do this. Okay, you can do this. And in other surgical discipline, be it uh, uh, I would say orthodontics. If you want to do a rapid accelerative phenomena using the piezotome, you can cut the buccal cortex of the impacted tooth, and you can put your braces or activator to cut it, to keep it aligned with the remaining tooth. This helps a very important principle. And in other principles like neurosurgery, where you need to take a graft, the calivarial graft, and in orthopedic surgery, you can use it. You can obviously, and in other surgical principle like pediatric and other principle, you can use the surgical disciplines, right? Obviously, which we have discussed it, the to every human there are good and bad quality. Similarly, to all the operating systems, there are few advantages, so to that of few drawbacks as well. Obviously, it has increased operating time. It has increased uh, operating time in comparison to the conventional instruments. But considering the advantages it provides, I would say I would rather spend 10 to 15 minutes more to have a patient that is convenient in a short term, and to have a success that is on a longer term. So in such scenario, I'll prefer to use Piezotome in comparison to the conventional conventional rotary instrument. There's a flexure fatigue. Some people have noted that their tendon and the metacarpal joint, they get fatigued when you use it on a longer term. And there is a limitation in, and there's a limitation in pacemaker patient, right? There is a limitation in pacemaker patients. So, and breakage of scalpel can happen if it is in contact with other metallic retractor as a result of interference with ultrasonic vibrations, right? So what happen is, when you use your inserts or the tips, or you use your inserts or tips with the piezotome, what happens that it basically cuts the bone. But unfortunately, if the tip touches the retractor or other metallic instrument, because it works on the principle of piezoelectric, which is based on ultrasonic vibration, when it connects with the other structure which cannot be cut with the help of ultrasonic vibration, it converts the horizontal amplitude of the insert or the tip to a vertical amplitude, resulting into the breakage of the tip. There is a question from our listener, our candidate, that Pratik Shah. He has written in the chat that, can we do osteotomy for basal implant? Yes, you can. For the osteotomy for the basal implant 2 mm, you obviously can do it for the osteotomy implants. Okay, you can basically do it for 2 mm implant. Basically, there's only the 2 mm intersection in the cases of basal implant, and I would advise you that we can discuss it in the next lecture, where I have discussed and where I have uh, uh, showed the cases where it can be used in implantology, be it conventional or be it the basal implants. Okay, so hopefully by this we have break the myth that are associated with piezo surgery, right? Let us discuss them, the myth that are prevalent in the market, that how come the myths that are there uh, uh, in the piezo surgery. It has a limited use. Obviously, it has a very I would say vast area of usage in piezotome. It is upon us that how and well we can use the piezotome, how well we can use the piezotome, right? So it is upon us, either we can use in the sinus surgery, or in the different arena which we have already discussed. So I won't say that it has a limited use. In fact, it is not used as it should be. Costly, I would beg to differ that piezotome, considering the I would say value it brings on to the table, considering the value it brings on, it is rather I would say uh, cheaper or cost effective in comparison to the other rotary instrument, considering the value it brings on to the table, right? So, and slow in nature, no, I would rather further differ that the success that it brings on the long term, I would happily I would happily uh, keep my 15 minutes, considering the nature of this piezotome surgery, because of the relative ease to the patient, and the preservation of the various anatomical structure. I would say that I would rather I would rather be on the side of the piezotome, right? And considering the slow in nature, we will be discussing into the next slides of implants and the sinus surgery, that despite being slow in nature, we can put implant in deficient area, that is as less as 1 to 2 mm, as less as to 1 to 2 mm. We can discuss that. And proper training is needed prior. I would say partly yes and partly no, and it happens with all the procedure, be it implantology or be it any stuff in dentistry. Everything to anything is dependent on the personification of the dentist. That learning is a gradual process, is a non-ending process, is a lifelong process. Okay, so it holds true for Piezotome as well. So if you are immature in learning Piezotome, you will get home cooked, and obviously at the same one point of time, you will get so used to it as I have, that you will be becoming an expert in Piezotome. And lastly, and I would say that if you keep performing the skill that is as basic as using Piezotome, it will obviously require patience and perseverance at one point of time, but after 2 to 3 surgeries you will get used to it. Okay, and I would say educate dexterity and dental touch with a proper learning curve is required, and which obviously there with I would say all specialties of dentistry, all specialty of dentistry, and that is there. However, I'll repeat that despite these flaws, they are very, very much minor in comparison to the assurance, to the safety, to the preservation of the anatomical structure, to the long-term success of the surgery, to the health of the marginal bone in and around, to the marginal bone in and around the osteotomy site. These are the things which I would say holds a very, very huge advantage, or gives a very, very huge advantage, a USP to Piezotome in comparison to the conventional rotary instrument, because it allow the trauma, that is surgical trauma, to very, very minimal in nature, and very, very I would say less invasive in nature. So these are the things which are there. To sum it all, I would say this is the lecture which was there regarding the usage of piezoelectric. Obviously, we will be seeing the used cases in the coming lectures, that is the implants, the sinuses, and the advanced cases of piezoelectric units. So in such cases, the I would say the you would see the proper videos, proper images in coming slides. And the I would say the piezoelectric would be it is predictable in nature, which you have seen it. It is precise because its insert tip is as thin as zero point 0.2 to zero point 0.3 mm, and it is obviously giving compliance to the patient. It is very, very very, very, I would say, ease for the patient to undergo surgery under piezoelectric scalpel. It preserves the tissues and it allows the tissue to heal. In fact, in the anabolic stage, I've seen cases where I have done BSS surgery and other orthodontic surgery. Patient has recovered in a span of 2 to 3 days, which would not have been possible with rotary instrument. It would have taken minimum of 5-7 days with a lots of trauma, with I would say the pain, the swelling, the discomfort, the gagging process, and all that structure that happens with the rotary instruments. It by its own nature do not cut soft tissue, and as a result of which there are a lot of tissue that are preserved. And lastly, I would say the post-operative pain is very, very less. Post-operative pain is very less. So in such cases, you can see the usage of Piezotome is very much required. Lastly, I would say to every field of dentistry, in fact all medical field, you can learn to infinity and beyond, and there is no stoppage of learning. Still, if anyone have its own doubts, queries, or if someone needs literature regarding the Piezotome surgery, feel free to email me or drop me a WhatsApp message or a simple message. I'll be glad to help. This is my email ID and this is my contact number. And here I conclude my presentation. And sorry for the camera not working properly. I'll look upon it. And still, someone has any query, we are open to for question and answer session. So there is one question. Let us start with some few questions. I'll repeat all the questions. We have already seen it. In Sohrab, he's saying that can we cut the tooth? Yes, we have already discussed it. That we can cut cut the tooth, right? You can see it here. We can cut the separate the tooth roots, hemisection, root amputation. Okay. And the other question by Sohrab only, he has asked, can we use it in delayed implant? Yes, you can see it here. We can use it for the implant socket preservation, right? In the implant socket preservation, and you can prepare the socket, which we will be seeing in the coming lectures. That how can we prepare the implant socket, right? How we can prepare the implant sockets. And the same question of Pratik Shah, he can use it. Can we do osteotomy for basal implant? Yes, you can do implant socket preparation for both the conventional as well as the basal implant. Okay, so these are the questions. If still someone has doubts regarding the Piezotome, you are most welcome. Okay, so let us meet again in the next presentation that would be scheduled on in coming Sundays, where we'll be discussing regarding the implant, the sinus surgery. If anyone need lectures, articles which we have already discussed, feel free to connect with me in the meantime. Uh, Wish you a good evening, and let's connect in the coming Sunday.